I'm Professor Vincent Sezibera. I'm the president of the Rwanda Psychological Society, a teaching staff from the University of Rwanda. I'm a professor of clinical psychology and director of the Center for Mental Health at the College of Medicine and Health Sciences. The National Trauma Symposium has a very meaningful background and reason of being organized at a certain time. The first time we thought of having a National Trauma Symposium was in 2019, when the country was commemorating the genocide against the Tutsi for the 25th anniversary. We were motivated by the fact we realized that the country was confronted to the genocide when we didn't have resources and structures to take care of those who were needing help. And we decided to have the theme around from grassroots intervention to institutionalized intervention, to revisit what we were able to achieve during the last 25 years in terms of trauma management, trauma healing. How do we learn from local and homegrown solution in managing the trauma as compared to traditional ways of trauma treatment. And from that first National Trauma Symposium, we committed to regularly organize the Trauma Symposium, either after 2 years and on a particular occasion. Like now, after the 30 years after the genocide, we committed to organize the second one. Outcome and achievement from the first symposium after the last 5 years are very significant. Because after the first symposium, it was resolved and committed to inform the policy making, to share knowledge with policymakers, to disseminate the existing evidence, to inform practices and to equip practitioners with the necessary knowledge and skills. It was also resolved to encourage and promote mental health through the creation of private clinic, and also in addition to the clinic setting, to promote and encourage community-based and psychosocial approaches in managing trauma cases. Today, we are having more than one private practice. There are interventions and initiatives in the community that are operating from that community-based and psychosocial support. We do have members of the consortium, like community-based social therapy, Imbuto Foundation, and Imbuto Foundation is one of our partners, very strong partners, who are supporting community-based mental health through the Bahoneza mental health. We have others who are understanding that managing the trauma from the genocide, we can benefit from the clinic, but very importantly, in our context, the community-based and collective-based approaches are also meaningful to support what we can achieve from clinic setting. We're also seeing the difference in the mindset of our population as a result of that first National Trauma Symposium, where the mindset is changing from stigmatizing those who need help to the understanding that those who are facing trauma-related difficulties, they are there to be supported, not to be rejected. We are seeing from the community, especially youth-led initiatives that are also very supportive to the youth who are facing trauma. from the peer-to-peer support, and also encouraging those who may need help to seek help from either the clinic or community interventions. The Trauma Symposium contribute a lot to improving the service delivery and trauma treatment. Since during the Trauma Symposium, we have practitioners, clinicians, researchers sharing their evidences from empirical studies being randomized control trials, longitudinal studies, but also very importantly, practitioners sharing their lessons learned from the practice. Also some of the challenges that are reported, either from research and practice, inform future research project. And this is why, for example, when we look at the existing results from research, we have noticed that we have some evidence, but most of them are from adult population, and there are few that are addressing the needs in the youth and adolescents. This is why currently there are an ongoing study to understand mental health needs and determinants of seeking help, to include stereotypes, stigma, but also limited service and quality of services. That can be one of the challenges to seek help. We are also aware of a number of challenges that affect mental health, either in adults or in youth, that are linked with the family structure and family dynamics. What is happening in our families, being single mothers, single parents, but conflict in families are immediately linked and affecting the mental health status and seeking help. So a trauma symposium like this one, it is a platform that brings together researchers and practitioners that constitute a consortium where all the practitioners from different organizations and researchers, they meet and become one team to talk about all of this and commit to either jointly or separately to conduct a number of activities that either promote or help in understanding the magnitude of the phenomenon and to work accordingly. And very importantly are the policymakers who join the move and to learn from what the research is bringing as evidence to inform either the policy making or the decision making. The second National Trauma Symposium that is scheduled to happen November 7th to 8th, we have decided to have a very meaningful theme, from trauma to resilience. 30 years after the genocide, the community, the country, we are seeing a lot of and very interesting development from the economic growth, infrastructure, but also the national rebirth. We are seeing strong people doing great job in their life, and we realize that we cannot only look at the legacy, the aftermath of the genocide from the trauma and vulnerability perspective only, and leave behind while we are seeing the reconstruction, the recovery, the relief, and to not try to understand what are the resilience factors that are behind, that are predicting or supporting that growth we are seeing in people and the nation globally. During this second National Trauma Symposium, we want, of course, to keep in mind that the population, Rwandans, are affected negatively by the genocide from the mental health perspective and also psychosocial, social interactions, but on the other hand, to be mindful and to be conscious that there is a lot of resilience behind and that gives us that hope of a future bright, that our people, yes, while struggling with the trauma-related difficulties, but we are also seeing that very inner resources, energy that is boosting and improving our quality of life, and that gives also hope to mitigate the intergenerational trauma that is also expected to be associated with that historical trauma. But with the resilience from the community, resilience from our culture and traditions, resilience from all the initiatives the country have undertaken, we are seeing that it's contributing to the betterment of our people. And so we believe in the vulnerability, but very importantly, in the resilience of our people.